My name is Busola Oronti, and I'm here to present this work titled Development of IoT-Based Patient Health Monitoring and Management System. Actually, this work commenced before I left the shores of Nigeria to commence my PhD study in the UK. And the project, the student who worked on this project is Amushan KM. I, Oronti IB, and Orimolade are co-supervisors on the project. In September 2015, the United Nations adopted the 2030 Agenda for Sustainable Development, and this included the 17 Sustainable Development Goals. And goal number 3 of this was all about safeguarding healthy lives and promoting well-being in all populations by the year 2030. From data gathered by the UN, they were able to determine that at least half the global population do not have access to essential health services. And many of those who do suffer undue financial hardships. So the question to ask is, what do we need to achieve so that goal number 3 can be established? Obviously, universal and sustainable health coverage, which can be provided anywhere and obtained at reasonable low cost. When this project was conceived, we were able to observe a number of challenges that was applicable to patient monitoring for healthcare systems in low and middle income countries. Now, the first of these was the poor healthcare infrastructure, which limited and inadequately equipped hospitals compared to the large populations of this country. We have that. Then secondly, the need for healthcare providers to be close to patients physically. The third challenge we saw was the immobility of patients when restricted to hospital beds or wired to large machines. Now, this may not be typically a problem with LMICs. It's a general problem everywhere in the world. Then another challenge was the inefficiency and low quality of patient healthcare services. Our objective is to provide quality health care for all. And then, finally, we saw the need to improve performance and efficiency of conventional medical devices. Now, the overall aim of this work is to develop an IoT device which can monitor and manage patients' vital signs in home and ambulatory settings. We had a number of set objectives, and the first one was to improve the efficiency of the medical practitioner. Secondly, we wanted to offer constant monitoring of relevant physiological parameters. In this study, we focused particularly on body temperature and heart rate. And then the third objective we had was to deliver improved mobility, ease of use, efficiency, and lowered cost. And finally, we wanted to ensure a timely intervention and enhance health delivery in both high and low income countries. Now, this figure depicts the flowchart of the health parameter monitoring design. We can see that when the device is activated, the first thing it does is that it tries to establish connection between the microcontroller and the network, the Wi-Fi network. After doing this, the device takes temperature and pulse rate measurements using the attached sensors. We have the temperature sensor and the pulse sensor. And after this is done, it displays the reading on an LCD screen so that you can actually see what you have measured. Thereafter, it now saves the data on an online database. That's the first stage of the design. In the second stage, we had to establish some critical health conditions, because we said we want to measure body temperature and heart rate. What are the critical conditions that can generate a notification to the health practitioner? So we determined that a temperature greater than 40 degrees and lower than 30 degrees will be a critical condition to consider. Secondly, for the pulse rate, a pulse rate that is greater than 100 beats per minute or lower than 60 beats per minute would generate a notification to the health practitioner. This is the second stage. In the third stage, we developed a mobile app which was able to access the health parameters that are been already stored on the online database, and these parameters could be managed through the mobile app. Now, the app was installed on the health professional's mobile phone and also on the patient's mobile phone. Now, figure 2 shows the block diagram of the health monitoring and management system. We will see that the first block is the input unit, and there we have the sensors. Now, the sensors, they feed the output into the microcontroller. In this case, we used the Wemos D1 microcontroller, which has the same layout as an Arduino Uno. So it can be used because it has greater capacity, data storage capacities. So we considered using it. Now, the microcontroller is the core of the whole system. It provides output to the LCD, and then we have the online database where the measured data are stored, and then it also generates the SMS and Gmail notifications, which are sent to the mobile phone. And then finally, the Android mobile application, where we have, which resides on the mobile phone of the health practitioner and the patient under consideration. Now, when we were in the process of the design, there were some of the processes we had to go through. We considered each module of the device, and each module of the device was programmed individually and tested for functionality. Now, the pulse sensor was programmed to obtain a waveform that was similar to that of an ECG signal. Then in terms of the abnormal sensor readings, because really at that point in time, we couldn't get anyone with abnormal sensor readings. So what we did was that we disconnected the sensors from the microcontroller. This Now, this is some of our results. In figure 3, you can see the LCD display. It's not so clear, but this shows the temperature and heart rate measurements. Figure 4 is a sensor database table on localhost. Here we have the measurements that have been stored online. And then we have the longitude and latitude, which gives the location of the device and can ultimately identify the position of the patient. Now, figure 5 and figure 6, these are actually on the mobile phone, and the figure 5 is the SMS alert via IFTTT, and figure 6 is the Gmail notification using SMTP. Furthermore, figure 7 is the processing monitor. wanted to visualize the pulse rate. And we used that tool to visualize the pulse rate to make sure everything was working fine. Now, figure 8 is the IoT dashboard displaying the live device location, the temperature, and pulse rate. Now, this is the app, figure 9 in figure 9. We call it the Medic app. And it shows the login page and the user registration pages. There are some advantages of device over conventional health monitoring devices. And the first one is the online accessibility of patients' vital signs record for remote monitoring. So you don't really have to be close to the health practitioner. Secondly, there's real-time communication between the doctor and patient, irrespective of the distance. And thirdly, the device offers location tracking of patients. Well, if you have if there's an emergency, then we can actually track the location of the patient. The number four advantage, the system can produce medical data similar to those obtained from existing medical equipment. We're able to test this by taking measurements with the traditional equipment, and then we tried our own design, and then we compared the results, and they were favorable. And then number 5, the system is efficient, easy to use, and cost efficient. Now we're thinking of, because it's an ongoing work, we still have a lot to do on it, so we're thinking of taking the work further in this respect. The first thing we want to do is to incorporate other health parameters. There are quite many, but we've started with the heart rate and body temperature, but yeah, we're looking at other things. Secondly, the inclusion of geolocation, that is the identification of the patient location within the mobile app. Right now, it is taking place outside of the mobile app, but we want it to take place from within the app, and also to improve inbuilt interactive functions between the health professional and the patient. Another thing we want to do is to realize scalability for different communication networks and multiple users. And of course, we're looking at improving storage and security capability of the online database, and possible application of edge computing techniques. And finally, we will carry out preclinical and clinical validation on the work. Now, these are some of the references. Thank you for your attention.
Questions? Well, I'll have a question. One of the challenges for patient home devices is robustness. It's a hostile environment. Patients tend to destroy medical equipment. So what kind of a sensor, for example, do you use to monitor pulse, and what's the robustness of that device?
Well, actually, could you help me?
Give a picture.
The sensor we used. Sorry. Now that is the sensor we use, the DS. That's the name of is a temperature sensor, and we tried to we compared a lot of sensors when we were trying to do the design, and out of some of the sensors because we're also looking at the cost, so we had to come to a midway in between the two, at least starting, because of course we can take the work further. So we decided that we would use this based on, yes, two things, the robustness and the cost. So that's why we arrived at, this is the manufacturer's ID for the sensor. That's in the input unit there. And also we have the pulse sensor. That's there. That is it. So also those two considerations went into picking what sensor we would use for that. Yeah.
Okay, thank you.